the province and federal government want to provide childcare spaces for parents and children where they need it. At a joint announcement that was announced yesterday, the two levels of government announced plans to open 700 new childcare spaces in Manitoba. Joining us now is the Federal Minister of Families, Children and Social Development, Jenna Sudds. Good morning, Madam Minister.
Good morning.
Thanks so much for joining us. Now,
my pleasure.
Tell us about this joint announcement, because it's you and the province joining together to create new childcare spaces, 700 in all. Tell us about why this initiative is so important.
Well, it's really important to make sure that parents have access to child care where they need it. And our announcement yesterday, as you said, 700 new spaces here in the province enables parents to do just that. Focus specifically on two areas where we see high needs. And that is providing child care at healthcare facilities, particularly hospitals. So Riverview, St. Boniface are two of the sites, as well as at schools. Imagine dropping your kid off to school and having access to childcare there before, after school, or perhaps prior to that, before they start school, and then post-secondary schools.
So when you're going to university, for example, you just drop off your child at the daycare that's in the facility you go to.
Exactly, and that could be students, but it could also be staff as well, right?
Right.
So just making it easier, meeting parents where they're at, ensuring they have easy access is really what this is all about.
Okay, let's talk about some of the numbers. 324 new childcare spaces in healthcare facilities. Is this a plan from the federal government to recruit new nurses, new doctors, because the healthcare system is in dire straits right now?
Exactly. Frankly, it's important to ensure that healthcare workers are well supported. And in consultations, it became apparent, and I say in many provinces, but here in Manitoba, working with the province to, first of all, identify that need, and then actually take concrete action. And so this, of course, is good for healthcare workers, but the reality is it's good for all of us. It's good for society when we know that our nurses and doctors, healthcare workers have access to reliable, affordable care right at the healthcare facility. It means they can focus on their jobs. It frees them up to provide the health care that we all need. So really, it's a win-win all around.
And it's 24-hour care as well.
Well, that's just it. Healthcare workers typically, they don't work your typical 9 to 5. So being able to have access to care based on their own schedules, those non-traditional hours has been a struggle, and this is one way that we can help address that need.
And then there's also the spaces that will be created in post-secondary institutions and schools, like you mentioned. What have parents been telling you when it came to, finding that affordable child care and some of the challenges they've been facing, and how you're planning to address that?
Yeah. So when we started this mission as a federal government to build out a national child care system, our ambition was to ensure that it was inclusive, that it was accessible, and that it was affordable. And I will say the government here in Manitoba has been a great partner, and we've gotten to $10 a day quite quickly within our 5-year agreement, which is amazing. It means families here are saving about $2,800 a year per child. So we reached the affordability quickly, but ensuring that childcare is available where it's actually needed. And so I'll use the example of the public schools. So ensuring that there is a childcare center within a school where the facility is already existing, where there's often before and after care within classrooms, just makes so much sense. Using that infrastructure, but also recognizing that it's a place where parents are having to likely go regardless, whether there's older siblings they're dropping off, or eventually the school that their child will go to. So the convenience of that is really important.
We're almost out of time already, but part of the announcement was also paying tuition for early childhood educators, because there is a real need for that as well. Thank you, Madam Minister, for joining us this morning. We appreciate your time.
My pleasure. Thanks for having me.